I think that in workforce, for me, the important thing is just always to not shut off any possibilities. There are lots of opportunities to create new roles, to change roles, and figure out what's the best way to do things. All workforces that exist, physicians, nurses, dentists, everyone, seem to have some of the same elements. There are concerns about who is doing what and whether they are qualified to do those things, and if the current system is not meeting the needs of underserved and vulnerable populations, what are the options to try to meet those needs? I think that one of the reasons that the tensions in oral health may be particularly high is oral health has in many ways remained isolated from the larger healthcare system historically. And so oral health workers right now are not only feeling tensions among themselves around who is doing what service, but as they are becoming more largely connected to the overall healthcare system, there are now many more people who are and should be looking at oral health. And so it raises an even larger question of who is doing what and who should be doing what. Residents in pediatric dentistry are graduating and have spent many years thinking about perfecting their skills and becoming very skilled, which they are. And I think that there has been less focus on thinking about how they and their skills fit into the overall healthcare picture of what is needed, where it is needed, and how they fit in with the larger team of healthcare providers. I do think that there is a responsibility for those that are the most highly trained to be the ones in charge of the team and leading a team. However, I also would argue that our educational system does not at all prepare these individuals for this role. First of all, we know that most professions are trained in isolation, meaning that dental students are trained separately from nursing students, who are trained separately from physicians, who are trained separately from dental hygienists, and then we expect them to all go out into the real world and know how to work together. We have seen in many professions where we expect people to be leaders and managers, and yet our schools don't provide a lot of education on management skills. And those skills are distinctly different than clinical skills. No one can tell you you have to go to a geographic location you don't want to serve or to care for a population you don't want to serve. But many policy issues differ whether you're thinking about them at an individual level or a population level. And at a population level, I would say you are free to work with who you want to work with and find your niche, and that's fine. But from a policy level, we have to think about the people that some people are choosing not to serve, or people that can't be served. I'm not saying I'm not trying to place the blame on the providers. There's certainly a lot of issues with accessing care around literacy, about appreciating the value of care, but we have to think in many ways about those that are falling outside of our system.